Good morning, everyone. Thank you for joining this presentation. My name is Logan, and I am joined with my colleague Maimuna, and we have been hired as the unit supervisors of the new rehab unit at Memorial Hospital. Today, we will be presenting our chosen patient care delivery method and staffing pattern for this unit. We'll discuss the specific constraints and requirements we need to adhere to, the details of our staff, the implementation plan, and how we will overcome potential challenges. So let's begin. To start, let me give you an overview of our rehab unit. This unit is designed for chronic, non-acute patients who are admitted for an active 2 to 12-week rehabilitation program. The primary goal is to help these patients return to their homes with adequate ability to perform activities of daily living. We expect our patients to mostly have conditions like cerebrovascular accidents, spinal cord injuries, other neurological deficits, and amputations. This unit will be part of a multidisciplinary team that includes an occupational and physical therapist. Given the high demand for these services in our community, we anticipate a waiting list for beds. So what will we choose as the patient care delivery model and staffing pattern for this unit? So to start off, let's review the constraints and requirements we need to follow. First of all of the staff has to be licensed. The ratio of LPNs or LVNs to RNs must be 1-to-1, and an RN must always be on duty. Our budgeted nursing care hours per day, or NCH per PPD, is 8.2 hours. Although I, as the unit supervisor, am not counted as NCH per PPD. The 4 hours per day worked by the ward clerk from our pediatric unit will also be included. This unit has a capacity of 7 patients, but we expect a daily average census of 6 patients. We have the flexibility to use any mode of patient care organization, and we will explore the most suitable model for our needs. Here's the breakdown of our staff. We have hired 4 full-time RNs and 2 part-time RNs. The part-time RNs prefer to work at least 2 days in a 2-week pay period and are willing to cover for most sick days, vacations, and some holidays. We also have 3 full-time LVN or LPNs and 2 part-time LVN or LPNs. The part-time LVN or LPNs would like to work at least 3 days per week. To assist with various duties, we have decided to use the pediatric ward clerk for 4 hours each day, integrating these hours into our total nursing care hours worked. So, after careful consideration, we have chosen the primary nurse model for our unit, also known as the relationship-based model. This model assigns each RN to a specific group of patients throughout their stay, which ensures continuity of care. The primary nurse is responsible for planning, coordination, and evaluation of care for their assigned patients. This approach fosters strong nurse-patient relationships, which is particularly beneficial for our long-term rehab patients. The primary nursing model is known to improve patient outcomes and enhance job satisfaction among nurses. Additionally, it facilitates better communication and coordination within the multidisciplinary team. Now let's move on to our staffing pattern. To meet the required 8.2 NCH per PPD for an average of 6 patients, we need to provide 49.2 nursing care hours per day. Since the ward clerk provides 4 hours per day, the nursing care hours required per day are 45.2. This ensures that we meet the necessary care hours while maintaining compliance with our staffing constraints. From this point forward, I will let my colleague Maimuna take over.
Thank you, Logan. To cover these hours, we have calculated the total available nursing hours per week. For our full time staff, we have 4 RNs working 36 to 48 hours each per week, totaling 192 hours, and 3 LVN or LPN working 36 to 48 hours each, totaling 144 hours. Our part time staff includes 2 RNs working a minimum of 24 to 36 hours each per week, totaling 72 hours, and 2 LVN or LPNs working 3 days a week for 36 hours each, totaling 72 hours. This gives us a total of 480 nursing hours per week, which averages out to be about 68.5 hours per day. Our coverages include 1 RN and 1 LPN on the day shift, 1 RN on the evening shift, and 1 RN and 1 LVN or LPN on the night shift. This ensures that we always have the necessary coverage with flexibility from our part time staff to cover weekends, holidays, and sick days. Here is a sample weekly schedule showing specific shifts covered by our staff. As you can see, each shift adheres to 1:1 ratio and always includes an RN. We have balanced the shifts to ensure that full time staff are evenly distributed and part time staff are scheduled to meet their work preferences and cover any gaps. This schedule provides a clear visual representation of how we will maintain our staffing requirement while ensuring continuous patient care. To implement the staffing plan and patient care delivery model, we will start by orienting our staff to the primary nursing model and the new schedule. Continuous monitoring and feedback are crucial to ensure the model's effectiveness. We will regularly review patient outcomes and staff satisfaction, making adjustments as needed based on feedback and evolving needs. This approach allows us to maintain a high standard of care and quickly address any issues that arise. We anticipate some challenges, such as potential staff shortages and unanticipated patient needs. To address these challenges, we propose flexible scheduling and cross training our staff to cover different roles as needed. This flexibility will help us manage workload fluctuations and ensure that we can provide continuous high quality care. Additionally, we will have contingency plan in place for emergency staffing needs. In conclusion, we have chosen the primary nursing model for our unit, which aligns well with our patients' care goals and staffing constraints. This model provides numerous benefits, including improved patient outcome, enhanced nurse satisfaction, and better communication. Our staffing pattern ensures that we meet the required nursing care hours while maintaining flexibility and adaptability. Here are the references we used for this presentation. These sources provide valuable insight into nursing leadership, management, and patient care delivery models. Thank you for your attention and time. I look forward to your questions and feedback.